Common IV fluids used in IV therapy are categorized into hypertonic, isotonic, and hypotonic solutions for different uses in the body.
Hypertonic solutions initially raises the osmolality of the extracellular fluid. This causes water to shift out of the cells into the extracellular fluid. It is frequently used to replace electrolytes, treat hypotonic dehydration, and to treat certain types of shock. When administering hypertonic solutions, frequent monitoring of blood pressure, lung sounds, and serum sodium levels are necessary because of risk for intravenous fluid volume excess and intracellular dehydration. Hypotonic solutions contain more water than electrolytes, diluting the extracellular fluid. This produces a movement of water into the cells through osmosis. This solution is most often used for maintenance or to treat and prevent dehydration. However, electrolytes may be added to help maintain normal levels. When administering hypotonic solutions, patients should be monitored for changes in mentation, which may indicate cerebral edema due to the potential to cause cellular swelling. Isotonic solutions create no net loss or gain from the intracellular fluid. It expands only the extracellular fluid. This would be ideal for a patient with an extracellular fluid volume deficit. Isotonic solutions have a higher sodium and chloride concentration than that of plasma. It can be used when patients have sustained both fluid and sodium losses or in hypovolemic shock. However, excessive administration of isotonic solutions can cause extreme elevation of sodium and chloride levels. IV additives replace specific losses in the body. However, potassium can never be administered undiluted or by IV push because it can cause fatal cardiac reactions. Plasma expanders stay in the vascular space and restore vascular volume, which is helpful in the treatment of circulatory shock.
Now let's take a look at some of the most common IV fluids so you will be able to recognize them and understand their use in the clinical setting. Dextrose in water comes in concentrations of 5% and 10%. 5% is an isotonic solution but physiologically hypotonic. It has a glucose content of 50 grams per liter and provides free water necessary for renal excretion of solutes. It's used to replace water losses and treat hypernatremia, but does not contain electrolytes. 10% dextrose in water, on the other hand, is a hypertonic solution with a glucose content of 100 grams per liter, and it only provides free water. Primary use of these solutions is the provision of calories. Concentrated solutions may be combined with AA solutions, electrolytes, and vitamins to provide total parenteral nutrition. Our next solution is sodium chloride or saline. The goal of treatment for fluid excess volume is removal of sodium and water without producing abnormal changes in the electrolyte composition or osmolarity of the ECF. 0.45% saline is a hypotonic solution which provides free water, sodium, and chloride and is used to replace hypotonic fluid losses. It is a maintenance solution but does not replace daily losses of other electrolytes and provides no calories. 0.9% saline, or commonly known as normal saline, is an isotonic solution which is used to expand the intravascular volume and replace ECF losses. 3% saline is a hypertonic solution that is used to treat symptomatic hyponatremia. It must be used with extreme caution and administered slowly as it can cause dangerous intravascular volume overload and pulmonary edema when used in excess. Let's move on to dextrose in saline. 5% dextrose in 0.225% saline is an isotonic solution that provides sodium and chloride and free water and is used to replace hypotonic losses and treat hypernatremia. This solution provides 170 calories per liter. 5% dextrose in 0.45% saline is a hypertonic solution which has the same therapeutic effects as 0.45% saline, however, it provides 170 calories per liter due to the addition of dextrose. In the same way, 5% dextrose in normal saline is a hypertonic solution that has the same therapeutic effects as normal saline, although it also provides 170 calories per liter. Our last category of solutions is called multiple electrolyte solutions. Ringer's solution is an isotonic solution which has similar composition to plasma except it contains an excess of chloride, has no magnesium or bicarbonate. It does not provide free water or calories but is used to expand the intravascular volume and replace ECF losses. Lastly, lactated Ringer's or Hartmann's solution is an isotonic solution with a similar composition to normal plasma, except it does not contain magnesium. It contains sodium, potassium, chloride, calcium, and lactate in approximately the same concentration as those of the ECF. Lactated Ringer's is used to treat losses from burns and lower GI tract complications. It may be used to treat mild metabolic acidosis, but should not be used to treat lactic acidosis because the body cannot convert lactate to bicarbonate. It does not provide free water or calories.
Thank you so much for listening to our presentation. I hope this gives you a better understanding of different types of IV solutions and how you can best use them in your clinical practice. Thank you.